Ladies and gentlemen, welcome to A New Perspective. Joining me today is Dr. Philip Blaire. Let me read you this bio. I'm so lucky to have this gentleman here talking about CBD and the effects of our endocannabinoid system. But Dr. Philip Blaire is a retired colonel from the U.S. Army. He's a family physician and a consultant in disease management up in the Pacific Northwest. He graduated from West Point in 1972, attended the University of Miami School of Medicine, where he trained as an Army family physician, served as a combat physician in the First Gulf War. After medical assignments in 3 continents and 26 years in uniform, he retired from the Army as a colonel, by the way, which is pretty dang awesome, and has been consulting on complex disease management since 2000. Since 2014, Dr. Blaire has been studying, treating, and lecturing about the human body's natural endocannabinoid system, or ECS as we're going to call it here. ECS disorders appear to be the root cause of many chronic medical problems and inflammation. His goal is to restore health and performance by enhancing the ECS using diet, exercise, appropriate medications, and non-psychoactive therapies. He is the clinical advisor for Elixinol LLC and ProHealth Advisor Inc. Dr. Blaire, thank you so much for being here today. I appreciate you taking the time to be with us.
Joe, it's a pleasure to be with you and talk to your audience.
So you are a rare breed. I have been down the path of working with a lot of different doctors to help us formulate our products. And we have people on kind of the eastern and western side of medicine. We've got some herbalists and naturopathic doctors that have been really tied into plant-based medicine for a long time. We've got the Western medicine pharmaceutical side of doctors that have been helping us out with clinically studied, kind of double-blind, placebo-controlled studies, which we don't see as much of in the East. It's more of a long-term study. And here you are. You're this kind of rare bird where in a medical community that doesn't seem to, that argues a lot on different things, and there's different views on cannabis. Here you are as somebody who I would say has come from a very conservative background, West Point graduate, served in our armed forces. It doesn't get too much more conservative than from a medical practice. And here you are kind of hanging out in this plant-based world here that's showing all these herbal incredible benefits. How did you get here?
Well, after I left the Army, I started doing disease management, and I found that a lot of the standard and conventional therapy that we had was not meeting the bill and helping people get better and ultimately resolve many of the problems. We were continuing down the same pathway to disease, destruction, and impairment. And I was looking for another solution. And one of those solutions came to me and when I learned about cannabidiol. I started doing the research. I was amazed at the entire science that was behind cannabidiol and the endocannabinoid system. And it really opened up a whole new dimension of physiology that I hadn't realized, and many, many possibilities. And then looking further at it, I realized that it didn't have any significant adverse effects or toxicity. Hard to believe, but in the last 4.5 years that I've been working with it, I haven't seen anything adverse or significant that's come from it. But all of these different benefits, I used it for myself to find out how I could improve my performance. Used it in my family as well as my neighbors and my friends, and then starting using it for clients internationally in many different countries of the world: South Africa, Australia, New Zealand, across the U.S. And I've had the opportunity to talk with somebody in just about every state of the country and try to help them deal with some of their medical problems using cannabidiol. And I have to say that 75 to 80% of the time, we're getting a major benefit that comes from cannabidiol without any significant adverse effects. So it's been a real privilege for me to work in this area and explore it and find another dimension of how we can change people's lives, transform their lives using this valuable substance that really bridges between the conventional medicine on one hand and the herbalist on the other hand, bringing those two together using this endocannabinoid system and this valuable plant substance.
There seems to be kind of, I think we've all seen the commercials on TV, right? You see like if you took this particular pill, call this number. And then it always seems like there's this laundry list of side effects. Like, you take a pill for heartburn and then it ends up giving you 8 other things that were way worse than heartburn. And that is a fascinating thing, is there doesn't really seem to be any side effects of using cannabidiol. Can you speak to that at all, or?
Well, yeah. If you look at the science in the studies that have been done, there's been no evidence that it's caused any significant toxic reaction in whatever dose. Oftentimes, doses have been huge amounts, way, way above what any person would reasonably take, and they haven't seen anything major occur from that. There has been some fatigue. People have gotten tired, and there have been the minor complaints that we may encounter, whether it's a mild headache or fatigue or sleepiness. But these are all very, very uncommon, and they've not been significant. And none of the literature has reported an adverse effect of using cannabidiol to this date. So it's really quite extraordinarily safe, and it can be quite effective in a broad range of conditions.
So I want to speak to that for a second, because there's a lot of people, I'm sure, watching this for the first time that you just mentioned the word cannabis, right? And that automatically ignites a few different automatic programming going on in a lot of our whether it came from our parents or childhood or teachers or the media, or there's been a lot of rhetoric, I guess we can say, on the subject. But I want to make the distinction for people that don't know the difference between cannabidiol, CBD, I guess is what we're going to call it, and where we're deriving that, right, is because there's marijuana, which is a different thing than hemp. And you can actually derive CBD from both of those things, and depending on how you derive it, I guess would determine if it's legal or not. Can you speak to, number one, I mean, just the legalities of it, not getting high? And then I have a couple questions I'm curious about for the people that are afraid of being high or losing brain cells or all those fears that a lot of us were taught. Is that something that we have to worry about with this, or how do you see that?
Well, first off, I'd like to explain it fairly simply. It's not exquisitely accurate in terms of the technical aspects, but very simply for your audience to understand, essentially we've got one plant. It's cannabis, and cannabis is broken down into two types of plants. You have marijuana on one side, and you have hemp on the other side. So the marijuana contains THC, and that makes you high. The hemp contains CBD predominantly, and that's what makes you healthy. And I think if you keep it in that simple approach, then you have a better understanding of what's going on. By definition, hemp is defined as having less than 0.3% THC. So there's no significant amount of THC that's in hemp. Whereas if we're talking about marijuana, then there's all variations of the amount of THC that's contained in that. And so you get quite a bit of difference in those products. The laws have been set up right now to say that in many states, then anything from marijuana is restricted, and any of the products that come from marijuana are restricted. That's not exactly true for CBD and using hemp. So if you use hemp and extract it based on the 2014 Farm Act, then those products were intended to be legal for everybody to use and available in every state. And that's currently the way it is those products are available and they are legal and they are bought and sold in those states. Every once in a while, one of the states' justice departments figures that they want to follow a different direction, or they're interpreting the law differently. Hopefully the Farm Act of 2018 will clarify that and finalize the fact that CBD and hemp products are legal and can be sold and exchanged across state lines in everywhere. Now, with respect to any of the products that come from hemp, there's not enough THC in them to make you high. And that's not going to impair your cognitive ability, your functional ability whatsoever. In fact, for cannabidiol, it's actually the opposite effect, where we see cognitive improvement and refinement, recovery, and clarity of mind function, as well as visual function and muscular performance. So you get all of these benefits that come along with CBD without any detractors cognitively or physically. And those are the major advantages for cannabidiol without causing any impairment whatsoever.
So I'm kind of curious because I know you're a big proponent of talking about the endocannabinoid system in the body, and so our body has this natural ECS, this endocannabinoid system, and CBD interacts with our receptors. I think our CB1, CB2 receptors, but also THC. I think also has some medicinal values as well. I'm curious. I definitely want to talk about the way that our body receives CBD and these different receptors and how it works in our body. But on the THC side, just out of my own curiosity, I know that it has some medicinal value. Are you a proponent of people using that in a medical way, or do you steer clear of that whole thing? Or what's your thoughts on the THC side as well?
Well, clearly THC has value, and that's been well documented, whether it's a tumor or a calming, relaxing effect, and as an anti-nauseant. There's other areas that THC has been valuable for a number of different conditions, and I don't deny that those have effect. The problem is that it's restricted, and for many people, it does cause impairment. Even in
Right.
dementia, that has a role. But the problem, once again, is how much or impairment might you cause versus the benefit. So it's a benefit risk. There's also addiction potential working with THC, and many people want to avoid that. Most of the people that I talk to have a major medical problem, and they really want to avoid any type of impairment. And so they're channeling down the way to look at how they can improve or get back to normal in their bodies and in their functioning. And CBD seems to be the best for that. So 95% of my patients respond very well, will respond to CBD, but there's a few patients who do need to have some THC. Now, I don't have access to THC and I don't have any specific recommendations. The problem is that there is very little certification and clarification of exactly what those products contain on the market at the present time. And except for some states and some locales, you're not sure of exactly what you're getting, even in the way of contamination by pesticides and heavy metals. We just don't know what's in those at the present time until we get some sort of standardized testing that's happening. On the other hand, with respect to cannabidiol, we're seeing certification and analyses by third-party individuals that are verifying these products are in fact without any pesticides or any other organic material in them that could cause any type of harm, no biologics for any type of infection, and absent of any of the heavy metals or toxicity that could come from it. So you've got a very clean product coming from a high quality cannabidiol that's extracted from organically grown hemp products and a crop, and it can be really reliable and consistent is what I look for in terms of treating a patient. I want them to have the best probability of getting success with the product that I use. I don't want to have anybody turned off by having a bad experience or not getting the results that they're looking for that I can expect from the products that I use.
Yeah, definitely. There's kind of a give and take there with the FDA regulating things where on the one hand, when it is regulated, you can make sure that all the standards are in place and all those proper checks and balances are there. But on the flip side, it's very limiting for the rest of the other companies to come in and be able to bring a product to market when you have to go through so many of the red tape and things like that. So a third-party lab-tested product, I think, is something that everybody should make sure they see the efficaciousness and make sure they're not using pesticides and herbicides and all the crazy stuff ends up in half our stuff. It's interesting because my wife and I both came to CBD in totally different ways. I was one of those crazy kids. I was always, goofing off in school. Loved learning, but I just had the hardest time ever sitting still and focusing in on something. And so I have never been officially diagnosed, but all of my closest friends say, Joe, you definitely have ADD. And my wife is on the other end of the spectrum. She gets anxiety. And it's so funny, somebody who has never experienced ADD before, the best way I can explain it is you either are just like drinking out of a fire hose stream of consciousness where it's like one thought and another thought, and then you're having all this different thoughts going on, or you are so laser myopically focused on what you're doing that everything else you're just totally oblivious to. And that's what ADD is like. You know, a lot of actually entrepreneurs are it can be a strength in some ways and a total weakness in other ones. But my wife experiences anxiety, and I have never really dealt with anxiety. And the way she describes it is this feeling of like impending doom, that you can't put your finger on what's happening or what exactly is wrong, or it's not even a specific thought that you're nervous or worried about. It's just this overarching feeling of, oh, I just like it. And you can point almost to a place in your body. Like she'll feel it in her chest sometimes, or her leg. And so it's interesting because we both came to CBD for completely different reasons, and yet both had such an amazing experience from it. And so I'm sure you in your practice, right, and dealing with so many different people with so many different issues, I'm sure that's nothing new for you. But how did you, I mean, at what point in your practice did this start becoming something that you would prescribe or something that you would start giving to people? And what have you noticed as far as just the different range of experiences people are having with it?
Well, Joe, I think you point out one of the key factors about cannabidiol is that it's an adaptogen. It goes to and does the right thing in the right situation. It's not a matter of doing only one thing. It's a multi-trick pony in what it can do. And so that it addressed your attention deficit. At the same time, it addressed her anxiety issues. And what it did was it brought it back to normal. It wasn't a matter of one or overcorrecting to another area. It's a matter of bringing them back to the normal area. And that's the wonderful part that CBD offers for so many health conditions. And why I feel comfortable in recommending CBD is that I know that it's going to be a Boy Scout in whatever situation that is going to occur, that it's going to bring people back to normal rather than making them extreme in one way or another. And that goes along with the idea and the understanding that it doesn't have any significant adverse effects, and it helps people move along the improvement of their entire life so that they're just plain normal. You know, for people who are healthy and vigorous, uh, they may be normal. They may not see a whole lot of difference in using CBD. But when you get outside of that normal area, then bringing back to normal is a huge change, and what a great relief for so many types of problems. You know,
That's
in my
Well, just to say, like, I mean, one of the things I've like in giving it to my mom or giving it to other people is say, hey, man, you should try this. You know, feeling normal is not actually like a huge revolutionary thing. A lot of times, you hand it to somebody like, oh, I just kind of feel normal. But I mean, that's exactly what you're looking to feel. You should be feeling that way. But I'm very curious because just related to my own cognitive performance, I've really been into the nootropic industry and like trying to look at different products to increase focus, things like that, just because of my own things I've been dealing with. And I've noticed in researching CBD that they've used it for a lot of different neuro conditions, right? Whether like I saw a thing on concussion protocol for NFL players. They noticed that if, maybe you can speak to this, but if you got a concussion and you had CBD in your system, it almost acted like a little helmet for the neurons in your brain. And I've seen some other studies with just neurodegeneration kind of disease, Alzheimer's and dementia and things like that. Have you seen anything specifically related to like cognitive performance around what CBD does?
Oh, yes. I think it's really quite profound that it can bring you back to your full awareness. I was working with a veteran yesterday who had her first experience with CBD and complained of brain fog ever since she'd had some significant accidents that had occurred. And as a result of CBD, she was exclaiming consistently, said, I can't believe how clear my mind is working, how clear I'm able to process. And that was within the first 5 minutes of using a high quality CBD. The liposomal product that comes from Elixinol, it just had immediate response. And I like to observe people within those first 5 minutes at least, because I see these profound changes that occur, and I can point out some of them. You know, in other cases, I have worked with dementia patients, and I've found that in 9 out of 10 cases, I've been able to significantly improve dementia, where people become more aware, cognizant, able to function, make decisions, and converse in much more normal fashion. So it has incredible potential for recovery, but also, as you mentioned, acting as that helmet for the brain and protecting the brain from the damage that occurs, whether it's a traumatic brain injury from a major injury or blast or even concussions that occur. A lot of what happens, Joe, is that there is a body's reaction to these insults, and that reaction is worse than the actual injury that occurs initially.
Sure.
And so you get an inflammatory response or vascular changes that actually worsen the area of the brain and cause damage. What CBD does is actually protect those neurons from the damage and destruction that would normally occur and dampen the inflammation so that you're not getting that chronic inflammation that would go on that would lead to the destruction of other nerves. And that occurs in the brain, and I know that occurs in other nerves as well.
So it's funny, you mentioned you treated a veteran yesterday. There's a huge thing in our veteran community with dealing with PTSD and higher rates of depression, and it's a huge thing in our veteran community. Obviously, having served, I'm sure it's something that you've seen rise significantly since your days in the service. It seems like it's been growing more and more, specifically related to I guess you have the physical deterioration of the brain, but it's like those, depression and anxiety. These are things that it's hard to pinpoint exactly where in the brain it's going wrong. And yet it does seem to have this incredible effect for depression and anxiety and those things. What have you seen with like maybe helping out with PTSD or helping out with some of these emotional challenges that people have been dealing with?
Well, Joe, you're exactly right. What happens a lot of times is you get a brain injury or any type of trauma, and that induces an inflammatory response. Even depression has been closely located or associated with inflammation within the brain, people who haven't even had trauma. So if you can use a substance that penetrates the blood-brain barrier, gets to the brain, gets to those neurons, and calms that area down and reduces inflammation, then you're going to correct a lot of that depression. So I've seen that happen consistently using CBD where it penetrates, it reverses depression very rapidly, but it doesn't cause any adverse interaction with antidepressant drugs that people commonly take. So they can be taken safely together, but the CBD will affect them immediately so that they respond very quickly and they recover, improving their mood within 5 minutes of an adequate dose, and then going on to an to being joyful once again, and to have that depression lifting so that they're able to function. And in those cases, I suggest that people get back with their doctor and start considering removing the antidepressants that they're using. Joe, these antidepressants can take 4 or 6 weeks in order to get to a level of effectiveness. But with CBD, it's happening within days of
Sure.
use of it from the proper dose.
Well, and I've seen some of these antidepressants and antipsychotic medications. The side effects are suicidal thoughts and being more depressed, which is, it's not a laughing matter at all. It's terrifying. But there's so many people that are desperately crying out for help that they get on these pharmaceuticals, and then you're seeing sometimes that exacerbate the problem. And it's amazing to have a plant-based, in plant-based product that we as a species have been using for maybe as long as we've cultivated any plant, and to see that it has none of those side effects and helps out with that. But you mentioned reducing inflammation. I know that I read a study from Harvard Medical School talking about the unifying theory of all disease. And they were saying that the 4 horsemen of the medical apocalypse were all kind of riding the same steed, and that was inflammation. And so I've been really into just natural remedies. I've learned recently that just getting the proper amount of sleep, if you actually can sleep for a full 7 hours every night, it's a great thing to reduce inflammation. I don't know if you saw there was a study in Finland on the sauna, using the sauna for multiple times a week. I think it was 4 times a week in the study, radically reduced inflammation. But how do you see inflammation playing a role in disease in general? And how do you see CBD, I guess, as you say, calming the body down so that it can go out there and do its own job of healing?
Well, first, I agree that that inflammation seems to be the main trigger for a lot of the actions that take place within the body. Inflammation in of itself is not bad. We need that acute response to different stresses that we come under in order to change our bodies in the right way. Building muscle requires a certain amount of inflammation. The
Sure.
problem is that when it gets sustained and you get into chronic levels of inflammation, that leads to damage and destruction and impairment. So an acute phase seems to be appropriate. Somehow the body gets off track and goes into these chronic phases. Even after viral infections and bacterial infections, we can set up for some of these chronic things. For instance, Lyme disease, the organism that initiates that ends up stimulating this inflammatory condition that can lead to years of pain afterwards. The same thing can be true for different types of injuries, so traumatic brain injury, and that may be part of the problem related to PTSD. I do want to focus specifically on PTSD because I have seen quite profound improvements using cannabidiol from a whole plant source. So you're getting a full blend of all of the terpenes, the cannabinoids, in a balanced way and helping people recover rather than using some of the isolated CBD. Now, in the PTSD, certainly there's a complex disorder that's arranged. At least one portion of it has to do with inflammation, but it's much more complicated than that. Using CBD, you're able to block the pathways of that broken record that occurs where you're reliving these same memories over and over. And at the other side of that, you want to get rid of some of the bad memories and get them out of your system so that you're not remembering those negative emotions, as well as firing the cortisol and the fight or flight type of symptoms that go on.
Right.
It turns out that CBD is able to affect all of those pathways and regulate them to get people back to normal very, very quickly. To the point, Joe, in my experiences, I see remissions using cannabidiol for PTSD. So really quite profound in the ability for this substance to correct for both PTSD and some of these chronic stresses that we encounter in our brains from those types of injuries, as well as correcting for many of those chronic inflammations that we encounter from either injuries or other types of disease.
There's I read a quote from Hippocrates, the father of medicine. All the doctors take the Hippocratic oath when they become a doctor, and he has the quote that says, "All disease begins in the gut." And so I know we have more neural connections in our gut than we do, I think, in the rest of our body. And it's pretty fascinating, right? Where there's a lot of rise of autoimmune disorders, and there's a big rise of different conditions that people are seeming to have now, and a lot of it is traced back to we have a lot less gut bacteria than we did 50 years ago. Our kind of gut microbiome is off. How does CBD work specifically inside of the gut to reduce inflammation, or have you noticed something as far as helping out with autoimmune disorders or things like that?
Well, that's a lot to unpack, Joe. First off, when we're talking about the endocannabinoid system, CBD has some connections to the endocannabinoid system, but overall its purpose and its function seems to be to raise the level of the endocannabinoid system so that it's functioning more normally rather than being very effective at any of the one receptors that are there.
Sure.
So as in that particular concept that we talked about earlier where cannabidiol is really normalizing the body, the same thing is happening for the endocannabinoid system, which has very high rates of dysfunction within a number of chronic diseases, whether that's migraine or fibromyalgia or irritable bowel syndrome. And so with respect to the gut, very interesting phenomena that occur with CBD where we have more neurotransmitters in the gut than anywhere else, even more than what's in the brain. And CBD is regulating a lot of those neurotransmitters to really balance those out. So you're either reducing the number of contractions or the intensity of contractions and regulating the peristalsis or the actions of the gut, but also modulating those pain networks that deliver pain from the gut, so knowing what's going on. In addition, CBD has some very special effects on the lining of the gut that really normalizes the barrier and boosts up the tight junctions that keep other materials and particles from entering into the body.
Would that, are
Now,
you
it does
describing like leaky gut syndrome? Are you helping out with leaky
exactly.
gut? Yeah.
Exactly. And so with you have a high population of disordered bacteria, bacteria that are not necessarily our friends. They signal the body, and CBD actually has some signaling properties on those particular bacteria. But I want you to understand there's new evidence is pointing out that those bacteria are also producing signals that stimulate the vagus nerve and actually deliver messages to the brain through that nerve. And so you are getting an interplay. And what we're seeing is that the endocannabinoid system is this interface between the gut and our external environment, or our deeply internal environment in terms of the microbiome, delivering messages to the brain through this nerve and this hormonal system that we call the endocannabinoid system.
So the vagus nerve connects, from what I understand, your brainstem all the way down into your gut. So it's kind of the highway that travels between your gut and your brain. And so I guess if that would become inflamed, you'd have all kinds of, that would probably lead to depression and issues with your anxiety and things like that, I would imagine as
Well, I
well.
don't think it's so much the inflammation of the vagus nerve. The vagus nerve is the conduit. It is the telephone line that is connecting the two areas, the gut to the brain. This is a perfect example of that wonderful connection that we're recognizing between the gut and the brain that we really never associated in the past, and we can see evidence for that as it evolves, looking at the endocannabinoid system in particular.
So, so let's speak to that, because there is, it seems like it's gotten so much worse since I was a kid, right? When we didn't have diabetes on the rise like it is now. We didn't have autoimmune disease like it is now. We didn't have coronary artery disease like it is now. We didn't have even the mental degeneration of dementia and Alzheimer's to the degree that we have seem to have now. What is happening? Why are we seeing such an insane rise of all of these? I think it's 1 in 2 American adults have a chronic disease now. 1 in 3 are either diabetic or pre-diabetic. What, I mean, obviously diet, I'm sure, plays a giant role. Sedentary lifestyle plays a giant role. But is there, I mean, anything? I mean, what in your experience of dealing with so many different patients, what have you noticed have been what's changed?
Well, Joe, there's probably multiple factors that are involved with this deterioration that we're experiencing as a culture. Well, it's actually a global culture that we're encountering. And part of it has to do with the food supply that we're using and the food selections that we're using. You know, back 150 years ago, even as recently as 100 years ago, we were eating high fat, low carbohydrate types of foods, and we did not have the level of disease, as you point out, earlier on. Now, in 1980s, we changed over to decide that all fat was bad, and we tried to eliminate all fat from the diet. And the advocacy for a low carb, a low fat type of diet that has not been successful. In fact, what we see is when that was instituted, we have basically a rocket ship going off, looking at the curve where you're seeing an epidemic of obesity, followed by an epidemic of diabetes, followed probably not too long in the future by an epidemic of dementia that is considered as type 3 diabetes by some individuals. So at least diet
Interesting.
has a portion of that, but maybe it's related to some of the pesticides and the chemicals that are being used on these particular plants. There's been suggestion using that one of the chemical substances that we've used, Roundup, actually has
Glyphosate.
the
Yes, there's a huge Monsanto lawsuit. I don't know if you saw just a little bit ago. Over
yeah, I
$800
did, yeah.
million was rewarded, and there's more lawsuits coming. It's so crazy. But yeah, when I travel abroad, I've done a fair amount of traveling around the world, and we don't see the levels of obesity around in other countries that we see here. And you don't have the same levels of diabetes, and you don't have these same crazy diseases. And I think you're probably right. I think there is a huge correlation between the chemicals and I'm sure the pesticides that we add to these foods that play that huge impact.
Well, I don't agree with you, Joe. I think you're seeing epidemics of diabetes and obesity in many nations of the world, third world nations. In fact, one country has
Really?
contacted me, an island in Polynesia that is having a terrible epidemic of obesity and diabetes right now, as an incorporation because they've incorporated large amounts of rice. Now, we usually consider
Oh,
rice as to be a healthy food, but if you're taking it in quantity and you're not getting the activity levels that you need to have, then it can lead to obesity and correspondingly diabetes. Now, Joe, you also pointed out something else. I mean, it's multifactorial, so that it is exercise. We need to be getting the proper amount of exercise. We need to be getting the proper sleep as
right.
well. And things like some of these chemicals as a result of some of the GMO modifications for these foods, allowing for those chemicals not to damage them, then those chemicals may be able to insert themselves into our DNA and induce some sort of modification so that we're actually getting epigenetic changes over time, and that's leading to a greater disease state. Now, one of the problems that I'm seeing that I've noticed quite a bit is this anxiety issue that's going on. There's so much anxiety in the world, and you can say, well, perhaps it's the news, perhaps it's the
Sure, there's
stimulation
some of
from
that.
screens that we're watching. There's many different factors, but part of the
Sure.
problem may be dietary related as well. There's just a host of different problems that come up that could cause many of the diseases and illnesses that we're facing, and nobody knows for sure unless we can sort those things out. And unfortunately, nobody's going to agree. Everybody seems to have their bias, and they're not willing to accept or look at some of the other alternatives. And I don't think that's a scientific approach. I think that we as physicians need to be scientists. We need to look at the possibilities and theories of different approaches and consider some of the other options that might be out there, or some of the other explanations for the diseases as well as treatments. For instance, using cannabidiol in one of the first line agents rather than the last line agent for chronic illnesses, whether that's PTSD, addiction, or chronic pain.
On the addiction note, I read actually that it's so funny. When I was a kid, the argument against the cannabis thing was, oh, you're going to get addicted and all this stuff. But they've actually shown a lot that it actually helps reduce your dependence on opioids and helps you actually get off of addictive drugs like an opiate.
No question about it. I've seen countless numbers of patients who come to me because of chronic pain, looking for a solution, a better solution, rather than using the opioids that have all of those side effects associated with, that really don't help people get better. They just maintain them in a stable way, or control some of the pain. But then they're faced with the side effects of constipation, mental clouding, inability to really function, and continuing weakness with that. So it's not something to continue. On the other hand, if you're using cannabidiol, you can take care of the analgesia that's involved that you need for relief. You can improve the mobility. You can reduce the chances and the withdrawal symptoms as you come down off
Mm-hmm.
of the opioids. And hopefully you can get away from the opioids completely without having any toxic or ill effect. You know, one of the things that we thought that the opioids would be helpful for people on a chronic basis, we found just the opposite to be true, that it actually seems to potentiate some of the chronic illnesses that we were trying to take care of.
Sure. It's funny. So you mentioned there's so many different uses for as an adaptogen for people that have some type of an illness or they're dealing with some type of an ailment. What about for healthy people? I'm a fairly healthy guy. The only thing I can really think of as I've gotten older is when I was a kid, I could sleep anywhere on a pile of rocks. I could curl up on the floor and just like crash anywhere. And as I've gotten older, I've noticed, I don't know if it's the stress of the day or working or whatever, but my body wakes up early. When I was a teenager, I sleep past every alarm clock, and now I'm up before my phone goes off. But I have noticed with CBD, I sleep so good and I sleep deeply. It's that, that type of, wake up refreshed where you actually felt like you slept good all night, not like the type of sleep where you drank the night before and you feel like you didn't really get any sleep at all. But how have you seen it function for healthy people, and then specifically with sleep? I don't know what you've noticed in your practice with that.
Oh yeah, an improvement in sleep with CBD is really quite profound. Now, I don't tell people to use it specifically for sleep. It's one of the side benefits that come along with it. And more recently, I've been looking at some of the sleep studies that have gone along with using CBD, and I've seen at least a doubling of the amount of deep sleep that people have, and in some
Wow.
cases,
Wow.
tripling and quadrupling of the amount of sleep. One of the things that I've seen that is particularly interesting is as a result of jet lag or having to, maybe it would be if you're on shift work where you're losing a significant amount of sleep. How do you recover from that? Now, using CBD in that when you are in that recovery mode, it will help you get that deep sleep that you need to get that recovery so you're back on your feet and operational within a day rather than waiting a week to recover from a number of different time zones.
Sure.
And then looking at specifically the sleep profiles, you see this deep sleep in as much as 70% of the sleep time is spent in deep sleep. So really quite profound, and I think it has an enormous
That's
value.
awesome.
The other side of the coin is if you're traveling in, as I've done a number of times, as many as 13 or 14 hours on the plane, using CBD help with that fatigue that you develop while you're en route can help you to restore your cognitive function and your performance function. And at the same time, enhance your sleep quality so you make a fast recovery. So I don't think there's anything better for jet lag than using cannabidiol. But I want to go on to talk about healthy people because I think that's really important. Joe, you are healthy, but you've already told me that you have a little bit of attention deficit disorder,
Sure.
that you tend to lose focus. So what do we do now if we have these little quirks in our environment?
Or
Okay,
even
hey, take a cup of
potentially,
coffee in
or
order
even
to get
potentially,
some caffeine to get stimulated. Or, hey, I'm having trouble, I've got aches and pains in my shoulder. I'm going to use a non-steroidal anti-inflammatory or
sure,
use Tylenol. And
sure.
then at nighttime, well, you might be using a sleep aid or some manipulation in order to help you sleep. Well, those are all things that cannabidiol can do. Even to the point of you have a burn or a bite, you can put cannabidiol just onto that area and you can get relief within a matter of seconds of any pain or itching or burning that you might experience and enhance the healing effects. So this should be a primary substance for your medicine cabinet in order to take care of all of those other things. But wait, there's more. There's more in the way of performance. You already talked about it, Joe, in terms of your ability to really focus and get things done
Sure.
and be cognitively functional. But have you also noticed the physical attributes, the ability to hold your breath, that you can maintain anaerobic type of fitness like heavy weightlifting or sprints, and you can do that longer and then recover without any significant of pain. So there's a number of
That
really positive things that can occur using cannabidiol just for our overall well-being, even if you're the healthiest person in the world.
That's actually, I just had a pretty intense workout today, and I was like, man, I'm crushing it. And yeah, so even if somebody is sitting there listening right now and they're thinking, and I have no issues, I am fit as a fiddle, I sleep like a baby, I don't have any joint pain, I don't have any, I'm cognitive focused, tuned in all day, I have no anxiety. What would you say to somebody who would consider themselves 100% healthy, fit as a fiddle? How could they benefit from using CBD on a regular basis?
Well, I don't know that they necessarily could, but as we talked about, everybody's going to run into bumps or bruises, and they're going to encounter situations. Now, life is not going to be smooth all the time, and they're going to use one of these other substances, whether it's aspirin or Tylenol or Motrin, something like that, and they're going to use an antibiotic on their skin for an abrasion or a burn. there's no need to suffer with that. Or if you
Sure.
use those things, you can use cannabidiol in order to achieve those. Or if you're that healthy, then you don't need to use CBD. It's not a necessity in any case at all. Really, what I like to, I'm focusing on people who have an impairment, who have a difficulty and are experiencing adverse effects from the medications, or they want a more natural approach to avoid the pharmaceutical industry and some of the adverse effects that can come from that.
What
So,
about preventative?
for people who are healthy, they don't need to use it, but it may turn into an advantage when they're in a particular stressful situation.
Sure. And I guess, I mean, if I'm thinking about it, if in today's modern lifestyle, right, where we have more stresses today just from being plugged into technology like we are. Our fight or flight is activated a lot of the time. I would wonder, even as a preventative measure of just helping reduce inflammation on a regular basis, preserving joints, or helping preserve those neurons in your brain just so you can protect those neurons on a regular basis. I would imagine there's probably no downside to taking a positive antioxidant approach to it. And I know it does function as an antioxidant, right? And maybe you can speak to how
Oh yeah,
antioxidants work in the body.
absolutely.
But I know it is
So
a
it works in
powerful
a number of
antioxidant.
different ways as an antioxidant. It's very, very effective. Probably much better than vitamin E and vitamin C. So it's better than all of those substances, and it is very effective at penetrating all the tissues of the body. So it's got a wonderful ability as an anti-inflammatory. But you've also pointed out that has a preventative quality to it. So if you want to protect yourself from injury, in fact, there was an interesting study done in Colorado where they looked at people who had major trauma, who were admitted to an intensive care unit, and they were looking at survival. And they found the people who were using cannabis, who detected some degree of cannabis in their system, actually had almost 4 times as much survival as the people who did not have any of cannabis in them. So there's a protective effect that goes
Four
on, and
times?
there's something to be said for a prophylactic, using it when you're not ill, but you might be facing that situation. Look at an athlete who might be using it playing football or using a contact sport, the risk of concussion. CBD might prevent some of the problems that come from that concussion, and prevent some of the chronic injuries, the CTE, chronic traumatic encephalitis, that can occur in many individuals that we're finding more and more out about after brain biopsy.
Yeah, anybody I would think that's in at risk of getting a concussion, whether it's a football player, a boxer, or anybody where you're running the risk of getting your head hit, it would be like part of my standard protocol for sure to be on a consistent dose. Let's talk. I
Well, I
want to.
would like to get it into soldiers who are at risk in combat situations and have the protection there for them, who are very, very prone to getting in a combat injury and a blast or a traumatic brain or any other type of injury. But CBD could be protective, and we could get a much higher success rate and a recovery rate for those individuals, rather than losing many of them on the battlefield.
Totally. I want to ask you about some of the incurable diseases. Now, I want to temper this, I guess, with saying, our body is the thing that heals us, right? There is no cure for cancer, but there are bodies. Our body has the ability to heal our body. What have you seen with using CBD to assist the body? Let me make sure I say this right, in healing itself from some of these incurable diseases, right? I mean, we've seen it used as a major cancer treatment. Epilepsy, the videos are astounding to what people are experiencing with when they're going through an epileptic seizure, things like that. MS. What have you seen in your own practice with the incurable diseases, and how CBD is helping the body be able to kind of, not to say cure, but do pretty damn close, maybe?
That's the most exciting area that I have the opportunity to work with. It's a real privilege to be able to help people with orphan diseases, things that they've not responded to, or they have gone to the full limit of any type of medical therapy, and they haven't improved significantly, or to where they feel that they are functional. Using CBD, I've been able to help people make that progress, to make those changes, and also protect them further deterioration. There's clear evidence that CBD is protective, at least in animal studies, for protecting against neurodegenerative conditions. And so that is dementia from Alzheimer's disease, or it may be Parkinson's, or even several other different conditions that we encounter. All of these things can respond and can be helped, and the consequences prevented by using cannabidiol. We already talked about the PTSD. Otherwise, we don't really have a good treatment for PTSD, and this is an effective way, very simple to use. But I'm looking for other diseases that it can be very effective for. We know that it has been effective for different types of epilepsy, and all comers seem to have major benefit. Chronic pain syndromes are responding beautifully to cannabidiol, or at least reducing the amount of other drugs that have been required. I'm always looking for some rare and exotic diseases that can be helped by cannabidiol, exploring some of the mechanisms that CBD offers. Earlier on, Joe, you mentioned that the connections that CBD has on the endocannabinoid system, but I've already counted over 160 other mechanisms outside of the endocannabinoid system where it's signaling on the nuclear receptors, what is called the PPAR receptors. It's actually signaling within the mitochondria, and it's signaling on some of the other microstructures that are present. It's changing the metabolism of the individual cells. So you have a host of activities that are going on and connectivity within the body. And then the primary thing that I like to emphasize is, of course, the role for the endocannabinoid, the lifting of the endocannabinoid system by cannabidiol. You also mentioned earlier about those things like sleep and exercise and diet. Those are key elements in restoring and balancing the endocannabinoid system as well.
Sure.
So I see cannabidiol as just being one of those tools to restore the body and to restore the balance in these endocannabinoid deficiency disorders, and then going a step further for some of the orphan diseases in correcting or compensating for some of the deficiencies that may end up or come from some of the genetic problems or from some dysfunction that's occurring at the synaptic area. All of these areas are glorious opportunities for cannabidiol to do good without having any significant risk of any harm or injury.
One of the things I think we were talking about offline was how CBD will interact with healthy cells in a particular way, and then it will act in a completely different way with cancer cells. And I find that absolutely mind-blowing. But can you? I mean, I'm going to butcher it if I try to say it. But what were you saying about how that functions how it functions differently with different cells in the body?
Yeah, cannabidiol is an extraordinary paradox. It seems to do opposite things for different cell types and in different situations. A perfect example is sleep. If you take CBD, I described to you as traveling for 14 hours in an aircraft. It kept me awake. It kept me alert and processing. But at the same time, it enhanced sleep. So that's the first of the paradox. The second paradox is how CBD protects normal cells, and so that it keeps them from being injured, or the inflammatory signals is damaging them or leading to the death of the cells. But at the same time, if you're working on cancer cells, it actually induces inflammation within those cells and leads to those cell type of suicides. But that's not the only cell type. If we have inflammation in an area, how do you get rid of those inflammatory cells? CBD actually stimulates the death of some of those inflammatory cells to take them out of the circulation, to remove them from the area and reduce the number of inflammatory cytokines that are being released. And that's one of the other mechanisms that CBD has in reducing inflammation for a region of the body. And it makes it allowable that it can be used topically as well as orally and systemically.
So it turns your bad cells into lemmings that just go kill themselves when they go dive off the proverbial cliff, and your healthy cells that protects. That is like one of the coolest things I've ever heard. Let's dive into, and I want to get to this, as this is very relevant to where we are culturally today. There's a debate. There's a healthy debate going on right now in Congress and around. I guess the fight is for if we should be in control of our own medicinal, being able to prescribe this to ourselves and serve it for ourselves. I tend to err on the side of, we long before the last 100 years of the demonization of this crop, for a bunch of reasons that I don't think have anything to do with the medical side of things. We have been cultivating this plant for 10,000 years. I've seen some things that argue that it may be the first plant we ever cultivated. And there seems to be this big debate now on, should it fall? I mean, right now, cannabis falls under a Schedule 1 controlled substance. If it falls under the THC side, which shows it has no medicinal qualities to it, right? Which is interesting because we have things like fentanyl and cocaine that are Schedule 2 that apparently do have some medicinal values. I don't know how that works. But what's your, I'm sure you have the finger on the pulse of what's going on, politically and what's happening around that. How do you see things shaking up right now in the political sphere?
Well, the politics, I don't have my finger on the pulse of politics. It's hard to decipher what's going on. We're
like
very polarized at the present time.
So as far as, there's been a big move in the pharmaceutical industry. I don't know if you've seen a company, GW Pharmaceuticals. They've come out now with a synthetic CBD. And so I'm sure that the natural, just full spectrum substance is going to have a much better effect on the body without the side effects that we see in other things. I'm just as purely conjecture. I have no idea. But have you seen anything as far as the pharmaceutical push to try to move into this space, or how has that affected, I guess, your view on it?
Well, if we look at the pharmaceutical approach, I think they're looking for equal performance by the nutraceutical area, where they have the same standards that we hold the pharmaceuticals if they're being used as a drug. I think that they're only asking that if we're going to require double-blind controlled studies for a number of years, and in order to establish safety and efficacy, that the same standard should be used for substances like cannabidiol. And I don't think that's unreasonable. I think the unreasonable part may be that if you have a totally benign substance that's never been shown to cause any harm or toxicity, that it be restricted in any particular way. I think the only restriction that needs to be there is to maintain the quality of the product that should be there. In the past, with our nutraceuticals, there have been imports of products that have been contaminated, and they've not been very closely monitored. I think ensuring the safety of those particular products is very, very important. But
Sure.
overall, I think that the products that come from hemp should be absolutely legal, and in all different ways, no matter really what the product is that come from them. Perhaps the exception of something that if a product is generated that has some toxicity, then that may need to be restricted. But otherwise, I think those products should be able to be used as a food product or a nutraceutical, and not be have rigid exclusions or exceptions, such as scheduling as a Schedule 1 or even a Schedule 5 that they've put the Epidiolex substance.
Sure. Yeah, I mean, yeah, especially because you have things like methamphetamines or fentanyl or cocaine where they're not Schedule 1. Schedule 1, for those people that don't realize, I mean, it has to have no medicinal value. And then on the subsequent schedules, it can have some, but still be controlled. And I totally understand the argument for wanting efficacious testing and making sure that you're not getting a bad batch, and it has to go through the certain checks and balances. But to have
Hey,
a substance,
Joe, let's talk about isolate. You mentioned that
yeah,
Epidiolex does have isolated CBD in it. And what we've seen in some studies are showing that those isolate performance is sometimes less than half of the performance that you get from a biologically derived full spectrum type of product coming from a whole plant. And that's what I'm seeing with the quality products in my experience, is that they're much more benign and they're much more effective. And one study showed 31% effectiveness for an isolate CBD for epilepsy, like Epidiolex. And on the other hand, if you're using a full biologically derived substance, CBD, you're getting 71%. So pretty significant improvements, more than double using a biologically derived, that it contains the other cannabinoids, the terpenes, the tannins, the flavonoids, all the other substances, part of the entourage that really makes it more effective and makes it more benign, reducing the chances of adverse effects.
Yeah, we're in an interesting relationship with Big Pharma, right? Where there is a lot of money in disease management, not as much in potentially curing a disease. Once somebody is cured, right, there's not a whole lot of more money to make off of them. But in maintaining a disease, there seems to be a whole lot. And I want to read this quote. This was fascinating. This is just at a survey of the states that have passed medicinal marijuana laws. And this is interesting. It says, in medical marijuana states, the average doctor prescribed 265 fewer antidepressants each year, 486 fewer doses of seizure medication, 541 fewer anti-nausea doses, 562 fewer doses of anti-anxiety medication, but most strikingly, the typical physician in medical marijuana state prescribed 1,826 fewer doses of painkillers in a given year. As a physician,
that's really, really impressive. And I had the opportunity within the state of Washington and Oregon to introduce CBD as an alternate and herbal substances for a self-insured business. And in that process, we've saved over $500,000 for just about 26 patients who had complicated conditions using CBD and substituting for some of these high-cost drugs that are being used, whether it's being used for pain or for inflammation for autoimmune diseases like rheumatoid arthritis and psoriasis. So $500,000 in cost avoidance as a result of substituting for CBD in these situations. Very, very cost effective.
Is that cost
and
avoidance?
With great outcomes and no toxicity.
Is that cost avoidance for the patient or for the clinic, for the clinicians?
For the business, it's a self-insured business, and so out of their profit, they pay for the health insurance.
Oh, wow.
So any money that's preserved preserves the profits, but it also preserves quite a bit of money for the individual patients who have co-pays and deductibles that they have to ante up on a yearly basis. So it's saving quite a bit for them, but it's also saving for the companies so that they can continue to offer the insurance for individuals, a broad insurance at low cost to make sure that all family is cared for with health insurance.
That's incredible. So you're not worried as a physician if you're prescribing substantially less medications and not billing insurance as much? You're not worried about maybe eating into your own business as far as helping too many people get healthy or not seeing as many patients here?
Well, not me. I'm most interested in helping people and
Sure.
making sure that they get better. And I think most physicians are exactly that way too. They have to run a business. If they don't have as many appointments in one area, no doubt they can shift to another area and emphasize that and bring in patients from another type of problem. I don't think there's ever going to be a lack of patients in a particular area. It's a matter of the physicians broadening their scope so that they would include more people with different problems.
Definitely. All right, let me wrap it up here, and I want to ask you just forward-looking statements. I want to do the thing that everybody hates to do, is try to predict the future, which none of us are ever going to get right. But as you see, there's definitely a turning of the tide. I feel like there's this shift culturally where we've seen. It started probably a handful of years ago with certain states passing medical marijuana laws. And then it seems like CBD recently has just hit the market by storm, and there's this buzz going on about what it's doing. And it certainly wasn't that way even just a handful of years ago. As you look forward and you see the future of where this market is going, what stands out to you? Do you see this being something that expands beyond our borders? And how do you see this influencing, I guess, us, in the next decade rather?
CBD is expanding all over the world. I'm actually working with 2 independent countries who are interested in bringing CBD as a primary treatment modality for their countries to address problems like diabetes and obesity. I think it has a major, major role as well as addressing some of the addiction problems. Everybody seems to be interested in it, and I'm hearing more and more questions and inquiries, and more acceptance by the public who were formerly reticent and concerned about the marijuana connection, realizing that this has real potential. And it very much could change the entire trajectory of healthcare for the world in coming years.
Dr. Blaire, thank you so much for taking the time to be here. And just, I have learned so much. I know anybody that's been able to absorb this, probably have to listen to it a couple times to really take this in, but absolutely incredible. Thank you so much for taking the time to be here and share this with us. And I hope to have you back here shortly.
Joe, it's been a pleasure, and I'm glad to get this information out and share it with the populace, and emphasize how benign and how helpful CBD can be for a broad range of conditions. If you're using a quality product that can be effective, and I think they oftentimes people need to have some coaching in how to use CBD, so not to feel like they're are not getting the results that their expectations are there.
Definitely. Well, I know they'll get a lot of coaching out of this, so I appreciate it, and I look forward to having you back here.
Pleasure to be with you, Joe.
Later on.